Good morning, Dana.
Morning, Melissa.
How are you?
Well, thank you. How are you today?
Good. Thanks for taking a couple minutes as we start our day to just talk about what's the latest we've heard on the vaccine, particularly as it applies to our broader continuum, independent living, as well as assisted living. So, what did you hear yesterday as we were on lots of calls with the state and the governor hosted his press briefing?
Yeah, absolutely. Well, I want to begin with the Department of Health has activated Part B of the rollout, which means that vaccinations in assisted livings can be scheduled beginning on Monday, January 11th. And if you are a continuing care retirement community and included independent living in your red cap form, then it's more than likely that the pharmacy will show up with that amount of vaccine. But in all cases, we just really suggest that our members reach out to their pharmacy point of contact to discuss independent living, just to make sure that everyone is on the same page.
And Dana, we heard from a few members yesterday who had not yet been contacted, even for their nursing home. And so we later had the call with the Department of Health and CVS and got kind of a better understanding of why that could be occurring. So could you speak to where they might have landed in terms of categorization?
Yeah, absolutely. So, in some cases, we learned that with continuing care retirement communities, the CDC actually coded those communities as assisted living or an other category. And what that means is, unfortunately, they weren't contacted before now because they weren't in the 1A nursing home category. But if a continuing care retirement community has not been contacted, it's very likely that they were coded in that category and their nursing home assisted living will move forward with they should reach out to their point of contact.
And if a continuing care retirement community did not include their independent living in their original numbers, what should they do now?
I think in that case, they should contact their pharmacy and discuss those numbers, and discuss independent living. I think that they need to have that conversation to get on the same page and be very, um, you know, clear about the number that they need. I will say that the Department of Health is very supportive about including independent living because they are part of the long-term care campus, but it really comes down to availability of the vaccine and timing.
Yeah, and I think that the one message that we want our members to know, and to our members who are watching this, feel free to share this with your boards, your staff, family members, and your residents, that there is no doubt that everybody at the state level, at the federal level, wants these vaccinations in arms. I mean, they want as many Virginians to be vaccinated as who want to as possible. And so what this really boils down to is access, availability, and timing.
Yeah.
So the prioritization is around trying to get it to the most vulnerable first and then making sure it reaches everybody else. And could you just reiterate for a minute the fact that where we are right now is the federal program, and then at a certain point this transitions to the state for responsibility?
Yeah, thank you, Melissa, for making that point. This is a federal program, and so the state is very involved. And at some point, it's just transitioning to the state, but ultimately, it is a federal program. So there are some hiccups that we will encounter, but it is transitioning to the state, and the state does establish the prioritization, which does lead me to the governor's held a press conference yesterday to provide updates on the state's efforts to deploy the vaccine as quickly as possible. He indicated that there are a total of 8.5 million Virginians, which means that Virginia needs to administer 17 million shots, as each individual requires 2 shots for the vaccine to be effective. Virginia is currently receiving 110,000 doses a week, or 14,000 shots a day, and that the governor set a goal of receiving 25,000 shots a day in order to speed up the administration of the vaccine. He has also called the National Guard in to assist in administering the vaccine. He also announced that he appointed Dr. Danny Avula, the director of Richmond Henrico Health District, to lead the state's efforts. And then he also released the priority categories for the vaccine, which is really interesting. So if you might want to include the Department of Health slide here.
Yep, let me pull that up.
Point that the governor indicated that people 75 and over will be included in phase 1B. So that's an additional encouraging factor for independent living for those folks to be included. And then I'd also like to say, Melissa, that you had mentioned that we were on many calls yesterday. We were on a call with CVS and discussed independent living, and that was a very productive conversation. At that time, they were supportive of including independent living, a little unclear about where they fell, but said that they would certainly be included in Part B. So I think that all long-term care that includes independent living should be encouraged that at some point independent living will be receiving the vaccination.
Right, and I also want to point out something that we heard on that call from the Department of Health, which is no vaccine should go to waste. So when the pharmacy shows up and they've thawed a certain amount of vaccines, if there are some left over in terms of everybody who consented to be vaccinated that day has been vaccinated, if there are other people in your campus that are willing to be vaccinated, get them vaccinated. So do not let the pharmacy walk out with a thawed vaccine because it will just go waste. And we confirmed with the Department of Health yesterday that is the right practice. You heard that too, right, Dana?
Yes, absolutely. There are no vaccine police. If there are extra doses, they need to be used.
That's right.
Absolutely. Do not let the pharmacy go away with any doses unused.
And we did hear from a member on the call yesterday who said they had started a prioritization list so that if there were leftover vaccines, that's where they would go first. And I heard from a colleague in a different state who said their prioritization list were folks who lived in independent living but had their spouse or partner living in the nursing home. So they could be on the same trajectory with the vaccine. So I think members should just consider that as they're planning their vaccine clinics, don't you?
Absolutely. I think that they need to be very proactive. I think that, again, I would encourage all of our members to reach out to their pharmacy point of contact to discuss this issue, to get on the same page, to discuss logistics of their clinics. So the members that have had their clinics so far, they've gone very well. There have been some lessons learned and they were all positive. And so I think that members can be comfortable and rest assured that independent living will be vaccinated.
And in today's update, we'll be sharing a lot of the lessons learned that we heard yesterday on our member call, thanks to Josh Bagley, who's the administrator at Goodwin House Alexandria. I know, Dana, you want to plug something that's happening today.
Yes, thank you, Melissa. We are having an online event with Dr. Jim Wright to talk about alleviating the fears about the vaccine. So we encourage family members, staff members, communities to join our call today. So if you need the information, just please reach out to us. It's Dana at LeadingAge Virginia, all spelled out.org, and we'd be happy to send you that link.
And I also just want to point out that Dr. Wright was medical director at the first large outbreak we had in the Commonwealth at the beginning of the pandemic. And Dr. Avulo, who is now over all of the Virginia vaccinations, it was his Department of Health that was working with them. So these two gentlemen have been in this from the very beginning. So I think we've got some really great expertise that's going to be helping with us. Dana, as we wrap up, I just wanted to take a pause and say a couple of things. One, just remind all of you who are watching that Dana and I are here for whatever you need. So do not hesitate as you're reaching out to your pharmacy partners or you have questions to reach out to us. I mean, we want to know what's going on and we're here to support you in any way we can. And the Department of Health has been incredibly responsive to us and to members during this time, and we're grateful for that. The second is 24 hours ago, I don't think we had any idea what was going to unfold at our nation's capital. And I know a lot of people are saying they want a 2021 reboot, that we were hoping for a better start to the new year. So I hope that each of you as leaders in your organizations can take a moment today to pause and to remember that what is happening in Washington not only affects us as individuals, but it affects our frontline workers as well and our residents. And there is a lot swirling on social media, as always, and there are a lot of opinions. And this is not a political commentary. This is a leadership commentary that we are all in this together. And as we continue to manage the vaccine rollout, we continue to manage the outbreaks that are occurring in our communities, we have to continue to maintain and support the morale of our teams, not just through a pandemic, but through this continued uncertainty that we have as a nation. And so I just ask for you each to pause and remember how resilient you are as leaders, and remember how much your teams have on their shoulders. I know you do, but just want to acknowledge that this is the most unique time we've ever been as an American society. And we wish you moments of peace, moments of joy. And if there's anything that you need from the association in terms of supporting your team members, continuing to support them. We've done some work with partners on trauma, on resiliency, on all of those different areas of mental health and wellness. So don't hesitate to reach out to us for that as well. So Dana, thank you. Thanks for all you do and for taking a few minutes with me this morning. I appreciate you. And I know that we both just want to say thank you to our members for being part of the association and for all that they do.
Yes, thank you so much.
Okay, have a good day.